I have asked Ms. Sutton to be here this evening to do a presentation on what happens when we have a positive case. What are we doing? What steps are we following? Just want the public to be educated on what our part of this is and what our community's part is, to include the Lincoln Trail Health Department, Hardin Memorial Hospital, Cumberland Health. All of these groups working together. It takes a lot of organization, and Ms. Sutton has done a phenomenal job of the record keeping. My goodness, it's a lot of record keeping. I have offered her help, just FYI. And then she turns that over to Mr. Wright so that we are keeping all the records accurate each day, Monday through Friday for the district. And so the work she's doing is the reason why we can continue to stay open at this time. So.
I don't know if any of you watch the show Friends very often. You have some nods. So as you know, with each episode that comes on, it's always entitled The One Where Something Happens. A day in the life of Hardin County Schools, the one where we successfully serve our students while managing a pandemic. That's what we call what's going on right now. Because our goal is successfully educating our students still while managing everything going on. And being part of the family resource and school nurse world for the past 10 years in this position, this has multiplied that, but yet it is still a great evidence of when community and school systems work together with their teachers and their parents, what can be done in the face of horrific times. So she asked me to share what happens. So for example, just a few minutes ago, I got a call from an administrator. We have a positive student case. This is how we walk through, and I will touch on as many details as you would like, and if you want more, I'll give some more to you. So the school administrator will call me and state what the case is, staff or student. After that happens, the administrator, they have already been, I don't want to say trained, but we've worked on the protocols and changed as our government and as the Department of Public Health has changed them. They complete a form that goes to the Lincoln Trail District Health Department. That includes all classroom seating charts, bus seating charts, lunchroom seating charts, any clubs, any athletics, anything that's going on in that staff or that student's life in that classroom. And you think that's probably a pretty daunting task. They've got it down to about 15 to 30 minutes, except for the bus, because obviously they need to look at cameras. Mr. Corder is very specific, and he wants to make sure that what the chart is in accordance to the video. Once they've called me and they're working on their form that will be going to the Lincoln Trail District Health Department, I immediately call our superintendent, to which I just share to let her know that what is going on, where the case is located, and so forth. I then inform our PR director, Mr. John Wright. He goes to working to any type of letter that needs to happen. What we have done and established as a practice is at each school site, for the first time that there is an on-campus staff or student, on-campus individual positive, that entire student body is provided a letter. And then if there is an off-campus, the beginning of school, off-campus also included some kiddos, they had not even made it to school yet. They were already a case, and the Lincoln Trail District Health Department just let us know that those kids were not coming in, or what happened specifically, to be honest, they were probably at home as a direct contact, maybe of a parent, and after that 8/24, because that's when we started our documentation, August the 24th, they tested positive, but yet they had never been in on any of our campuses, so they were considered off-campus. Another off-campus could be if it was someone in our online learning academy. We do keep all of those, so totals that I share with you include our online academy as well. In addition to Mr. Wright doing that, then I look on Infinite Campus, I see are there other siblings and so forth throughout the district. I work with Mr. Stith. Just because it's not a positive case doesn't mean we don't need to be explicit with any of our extra cleaning procedures, and he is always wonderful to contact the other schools, or I will contact them, and extra spraying occurs in sibling rooms. Those siblings are not symptomatic, they're not the case, but they will most likely, 99.9%, because they live in that household, be considered a contact. We want all of our staff, all of our students to know that we are doing everything we can to keep down the spread of this disease. So that is something else that we do. Building and grounds has been wonderful and so forth. By that point, the health department usually has our all the information, and just like a while ago, they started emailing me. We need an additional contact number. We can't get a hold of this parent. We need to know something else about the bus and seating. They have one person that is a school contact there at the Lincoln Trail District Health Department, Melissa Phillips. I couldn't thank the lady enough. If you know her, make sure you pat her on the back at some point in time. She has been fabulous. She's the point of contact for all of, there's 5 counties that they serve: Marion, Meade, Washington, LaRue, and us. Marion and Hardin, we're the only 2 that are in right now. And then once they do their contact tracing, how does contact tracing occurs? How does that occur, excuse me? If it is a staff member, or if it is especially a younger student or a student under 18, the parent is always involved. The health department calls that family, calls that staff member, and based upon all the seating charts, everything that the school has turned in, and what the individual that is the positive case, they determine what direct contacts are. The definition of a direct contact has changed just 24 hours ago. It used to be closer than 6 feet, longer than 10 minutes. A lot of people keep saying, but I have my mask on, but I have my mask on. Mask has everything to do with reducing transmission of the disease. As far as being a direct contact, your safest is to remain farther than 6 feet, and where it used to be 10 minutes, it is now changed to 15 minutes. But with that 15-minute change, it's no longer a consecutive piece of time. So for example, I work very closely with Mr. Wise. Let's say his office is next door to mine. We have a lot of things that go forth. It's now cumulative time. I used to be able to say, well, I was never with Mr. Wise longer than 10 minutes in one block of time. But now it's cumulative. If I go out and speak to him less than 6 feet, 3 or 4 minutes. And then later in the day, 2 or 3 minutes, and so forth. Because a lot of people thought, oh, I'm just safe as long as I don't do that under that 10 minutes. But it has now been changed to a cumulative time of 15 minutes over 24 hours. And then the other piece they added, it's been a few weeks since they've added this as part of the direct contact: hugging, kissing, touching, and so forth, sharing any type of eating or drinking, and then if you have any respiratory droplets. So if someone has sneezed on you, coughed on you, and some things like that. So the total definition of direct contact: standing closer than 6 feet, longer than 15 minutes of cumulative time is the big word now, hugging, kissing, sharing any type of eating or drinking utensil, and then also those respiratory droplets. So that's how the direct contacts stand.
Excuse me, how far is the reach back? It's 24 hours no, it's 15 minutes cumulative over 24 hours, but that's not, but it's only back 48 hours total.
What we have found, in the contact tracing, what we have found is with symptomatic, and that's the only thing that we've dealt with here. If someone is symptomatic, suppose they come into work on a Thursday, and that morning they have the temperature, or they have the loss of taste, or they have the very, very sick stomach, and so forth. They get tested, and we'll talk about that a little bit further here in a minute, but they get tested and they are positive. The health department is wanting 48 hours back of information, and so forth. That the disease, what we know about it, and we've only been around it for 6 to 8 months, but what we know about it is that potentially 48 hours prior to presenting symptoms, you could have exposed someone else. So that's for that 48 hours.
Thank you.
Great question. That's where it comes about. So at ALM, I was talking with Mr. Stith and Mr. Sutton about numbers of staff and numbers of students, and we're going to go with a figure of somewhere around 16,500 total staff and students that we serve in Hardin County schools. As we stand now as a district, having been open since August the 24th, as of 5 p.m. today, and Mr. Wright's going to go, you have one more added on there because we did have one more added, and I just want to go ahead and tell. We have 27 total cases out of 16,500 folks. Of those 27, only 16 are active. And of those 16 active cases, 9 are staff and 7 are students. Of the 27 total cases that I mentioned earlier, 10 are staff and 17 are students. And when we talk between total and active, once they are allowed back, if you're a case, you're in isolation. That's the word they use. If you're a case, you're in isolation. Once you're no longer in isolation, you can come back to work or school, you're no longer considered active. So of our 27 cases, we have 16 active cases in Hardin County schools. Now, prior to Labor Day, I will share this information because Ms. Morgan and I found this quite interesting. We had 11 cases. So a 3-day weekend, some things happened and so forth.
So
But I
those,
will-
can I stop you for just a second? So those 11 that you mentioned that are not active were prior to Labor Day, but those are maybe back in school now?
It just
We don't know.
we're really not sure about that. I don't
Yeah.
have that written down. But there was 11 total cases.
Yeah.
And now there's 27
Gotcha.
total cases.
Right.
And that's
So the
how
impact there was huge.
Well, the isolation period, what is the official isolation period now?
The official isolation for a case
Uh-huh.
is typically 10 days from onset of symptoms and so
Yes.
forth. And then as far as direct contact, if you have been around somebody, is 14 days from that point of contact. We're learning new things. Like today I learned if I had a 3-year-old and I take my 3-year-old in and she gets tested, I'm her primary caregiver. There's no way for her to quarantine, isolate away from me and me to quarantine away from her. I'm her
Sure.
caregiver. So she has her 10 days that she is in isolation for being a case. I don't start my quarantine until she is complete. So that is an interesting fact, because we were getting back dates that people are in quarantine 24 days and 27. We're like, what is that? And it's people with younger children. You can't quarantine and get away from that and so forth, because you're the sole caregiver for that 3-year-old. I thought that was a very interesting piece.
On that point, something that's confused, that I spoke with some other school people in another district, something that's been confusing is the 10 versus 14. But 10 is for you present symptoms, and then that count starts, and by 10 days, they'll know your symptoms should be gone, you should be fine.
What we know about it.
14 is, the 14 days, though, is to allow, we know that it takes that long sometimes for symptoms to start.
Correct.
So that's why you don't show symptoms is longer than you have symptoms.
It was very confusing for our school personnel. We have had 4 of our cases, they started out as direct contacts, and we gave the return date for them as direct contacts. Once they tested positive, they were in their quarantine, they tested positive, their return date to school
Came back
was shorter.
Sooner, yes.
Because once you have contracted the virus, then you're going on and moving on with it.
Yeah.
But if you're just a direct contact, that viral load has to build up in your body, and that viral load is something you'll hear more and more about. Because right now, if I was with Mr. Wright and he found out that I was positive, I tested positive, he really doesn't need to run and go get a test right that minute. If he had just been around me and I'd just been coughing and had a fever, he needs to wait about 4 or 5 days to let that viral load build up in his body. Some people want to go ahead and get tested, and that's okay. Some people just need that security. You can go right back on day 5 and get tested again and so forth.
Okay, thanks.
Something really neat about these, not neat, but these 27 total cases, none of them can be traced back to any activities at Hardin County schools. So I do think that is important for us all to note and so forth. So.
And Janay, the other thing, do you mind to share about testing between your 14 days, what that does for your quarantine?
Pardon? Are you talking about the extended?
Like if a person decides to test on day 5 of their quarantine and they're negative, that does not lessen their
Correct.
quarantine.
A couple of folks said,
does.
well, if I get my test and I'm negative, can I go on back to school? They really want to get back to school. They really want to get back to work. But you still have to allow, just like Mr. Segal was saying, that time for that to all build up and so forth. So I want to be completely transparent. So we've talked about cases, and that are folks that have been diagnosed with it. But I also want to talk about our direct contacts. Our direct contacts right now, since August 24th of being in school, we've had 296 direct contacts. Of those 296 direct contacts, 159 are still quarantined. So that means around a little less than about 137 there. Their quarantine's done. Of those 159 that are still in quarantine, 39 are staff. Or excuse me, 32. 159 still in quarantine, 32 are staff. I apologize. Of the 290, I apologize, I have my little arrows drawn. 296 contacts. Of those 296, 32 were staff. 159 total still quarantined. Only 12 staff are still quarantined as direct contacts. Only 12 staff are still quarantined as direct contacts, and leaving 147 students. And I apologize for that.
Ms. Sutton, another item, they can be Hardin County students and count as a contact, but that contact may not have happened on our school grounds. Is that correct?
The majority, and I wanted a percentage, but I don't have that. I'm going to guesstimate between approximately 65% of all direct contacts had nothing to do with a case of the 27 cases in our school.
So what this means is largely is that whether we are in school or not, most of this would have happened.
Yes, sir. Yes, sir.
That's what it looks like.
Yes, sir. The activities that have happened and so forth. And some of them have been gatherings, and so it wasn't just one contact. And I'll tell you, a lot of them are simply household. One person in the household contracted the virus, so therefore everyone was placed in quarantine as a direct contact. I do want to share the importance of some ahas through all of this. One of them, the explicit following of protocols to our school representatives here tonight, our principals. I can't say enough about our attendance clerks, our office managers, our teachers, our building and ground staff. I mean, when Miss Morgan comes back and talks to me, she can tell my phone is ringing constantly and bring the questions in. They want to make sure they're doing it correctly according to what the current, and you guys know, you've been watching this since March, things change fast. And they want to make sure constantly they're doing everything correctly. And I think that is a huge part of our success. The parental support. For some reason, I had a vision when we started into this, they're going to try to slide their kids in. No, sir, no, ma'am. They call our buildings on a regular basis and say, my husband's tested positive. I want you to let you know my kids won't be in school. We haven't heard from the health department yet, but once we do, and then we have a protocol, they email me student name, person in the home that is positive. I put that on my spreadsheet. If it's been a day or two and we haven't heard the quarantine release date, then I'll contact the health department. I'm trying not to inundate them because they are already overwhelmed and so forth.
They have a pretty busy job right
Oh, an incredibly busy job.
Well, what you're saying is that communication is so effective for you, it helps you.
It's huge. They let us know what's on the horizon, I guess you would say. Our building and ground staff have been huge in keeping our buildings sanitized and not just clean for daily use, but when there's been a situation, when there's been a case, and coming in and taking care of it. The health department, Melissa Phillips again, and Stephanie Goff, we work hours. Saturday, Sunday. I got a memo today, or an email today that said they were no longer open on Sundays. And to that, I'm like, okay, I might get Sunday dinner back in, but I'll be honest with you, it scares me because now we got to cram everything back into 6 days and stuff. Because COVID diagnoses do not stop just because Friday at 5 o'clock the dinner bell rings and so forth. But the health department has been absolutely wonderful. And then I sat here and talked to, what was it, 4 years ago about school nurses when we started this, Charlie? I couldn't tell you. A huge success to the 22 school nurses that are in the building, the security they give, the immediate individual. I mean, one person came down, didn't have sense of taste. Immediately, let's get you to your car. Let me call over here. We have 22 school nurses, 4 nurse practitioners, and one very important thing, and that is a COVID rapid testing machine that Dr. Loy made sure Hardin County Schools had.
Yeah.
Because the CEO of that company knew if we were going to be successful, we had to have that. We've done since August 24th over 300 rapid tests, not including the PCR, which is about the 48-hour one. The white box you'll see hanging out on the back, that's LabCorp, picks those up and so forth.
How many PCRs tests have
I
you done?
asked for a total number, and they did not have that, but they did have over 300 because they gave us 50 swabs, and our lead nurse, Amy Hall, knows how many times she's had to go back and continue to get. And please share this with your folks in the community. They are set up like a Kroger clinic. They could see anybody. We obviously don't want outside, we can't have outsiders in
Yeah,
our
of
building
course, but-
and stuff like that. But if you have somebody, if people are bringing their spouses to be tested and so forth like that, if you have any type connection to the schools and so forth, they drive up right behind John Hardin, right by the tennis courts. That's where our nurse practitioner's office is. She comes up, she comes out from goggles and everything head to toe, swabs you, goes back in 15 minutes, you know. Now, Dr. Stack from DPH did say you must be symptomatic or you must have exposure to a positive case in order to have the rapid test. You can't just have the rapid just because you want it. That's, the PCR is also there, but that was the Dr. Stack from the Department of Public Health. But I can't say enough good things about our school nurses and so forth. I don't know, Ms. Morgan, if you want me to share, you guys can see this on our website. Mr. Wright and I work together. He manages and keeps it. I give him the numbers.
I shared that with them today.
Anytime you want to, you can go do that. I would like to share, and you might, I don't know what she's doing. Just so you can get a gauge on staff, students on campus, off campus.
Thank you.
Thank you.
I've taken the names off for
Please.
obvious reasons
Yeah.
and replaced them with an X. As you can see, the legend on the bottom, if the box is colored in blue, that was on campus. If it's yellow, that means off campus, either an online academy student, it happened before, they didn't even get to school, but it happened after August the 24th, so we had to still count them in our totals. Red lettering means that person is still active, and that should match up with our 16 active cases. And then blue, if there's a thick blue box around it, that is our staff. And the only other explanation, there is a little difference between my chart and what you'll see on Hardin County Schools. The Department of Public Health has added an extra layer to us. Katie, I don't know, is the Department of Public Health, KDE, somebody?
It was the thing that was announced last week about the reporting, I
Yes.
believe that was part of the Department of Public Health.
Public
that's what the
Health
governor said.
has added an extra layer.
Yeah.
And we have to report by school.
Yeah.
So if you see underneath Central Hardin, that X with the HCS, that is a district employee. And when you look on our Hardin County School site at our COVID chart, you'll see that person listed under a district. Obviously, you know there's lots of job classes in our district that serve several schools. And that individual that was positive, I asked the health department, I'm like, who will you turn it in under? And they said, wherever the individual has more direct contacts. So that individual had more direct contacts at Central Hardin than at any other building, like bus drivers. If you're trying to think, bus drivers, OTs, occupational therapists, physical therapists, those that go around and serve multiple schools and so forth. So under West Hardin, you'll see a district person, and then under Lincoln Trail. So if you were to take this chart and compare it to the one on the website that Mr. Wright manages, those three will be the 3 district numbers that you see. Any questions?
Is it important to know how much a rapid test costs and who's it for, who's paying?
That's an excellent question. Cumberland Family Medical has made it very clear they accept what your insurance pays. If you do not have insurance, then they will complete it and do it. You can do what you can, but they will make sure that it's completed.
Thank you.
It's a great question.
Are there any plans to do the serology antibody testing at some point to know who's been exposed.
Cumberland already offers that. We've had several staff that have asked for that availability. I set one up just
That would be
yesterday.
interesting to some of us, because based on symptoms and such before we knew, there's people that work here that, you know, probably had something before they knew it was something.
Absolutely,
You know?
absolutely.
Okay.
And they're completing those, taking the blood test and so forth.
Uh-huh.
And on that, the only thing that they continue to say is, what we don't know about the virus is, will you continue to, is it past that 3-month period?
Right, yeah.
And so forth.
Yeah, because we don't yet know how it works. We don't know how long you'll have immunity if you do.
Correct.
We're counting on that you will, though, or we wouldn't be working on vaccines.
Absolutely. So.
This is very helpful, thank you.
Thank you
This
so
is good.
much.
I hope this gives you a good gauge. I hope this makes you even more proud of our district, and what our teachers and our staff and building, I can't say enough about the folks. When you go to climb Mount Everest, you hope you have the best team at your side, and I can assure you, you do, and so forth, because there's no way.
Before you leave there, I had a question before, and I thought I'd have to ask it, but you covered it. And, you know, when the governor announced the new system last week and explained what we were going to have to do to how schools are going to have to report, I thought, well, I think we're already gathering all that information. The only thing is we're going to have to slice it and dice it differently. And you answered that question, so good job on being prepared for that.
There are lots of curveballs. My children will tell you I am not the athlete in our home and so forth. But we have been thrown a lot of curveballs. Some of them have hit us square in the head, but that one we kind of saw coming, and so forth, working closely with the health department. The one piece that they have added, the layer that thought might be going to be tough, but once again, the health department, we partnered together. They want what we report to be school connected. So when you tell me a direct contact, if you're a direct contact because your dad has it, you're not a direct, I can't turn you in as a direct contact school connected. And so Melissa and I worked out a system already to where when they send those names to us, that we'll have that set up. So.
Thank you.
When we put that information, when Mrs. Sutton uploads that information to that state website, we'll provide that link on our website as well. So,
And I will tell you, right now, the state already has a website, and I want to call somebody and say, y'all are behind. You're not doing, but I can't do that.
Yeah.
So forth. I don't think they'd listen anyways. But we're keeping it, like I said, John and I every day at 3 o'clock. Everybody has 4 o'clock with Andy. I have 3 o'clock with John.
Thank you,
Thank
Ms.
you.
Sutton. And
Thanks
again,
so
they
much.
have worked incredible hours to make that. I do just want to talk about, to add to that, our school district is doing phenomenal. That does not lessen the importance of being aware. It does not lessen the need to follow the guidelines at all. If anything, this success tells us we can't let our guard down. We are experiencing right now what happened after Labor Day, and what I've told people is you have to be, and you can tell from this sheet, you're going to have to be as committed outside the building as you are inside the building. And if we can get everyone to be that committed outside and to be safe and to wear a mask and to social distance, and it is hard to do when you have family, but of these, the people who have had to quarantine, you got to realize some of those people on this list in quarantine have children that they had to be away from, or aging parents that they care for that they had to be away from. So it is
That's
good as these numbers look, and I am incredibly proud because our administrators, our district office, like Janay said, have worked endless hours to make this successful. We can't forget the impact that one slip up or one forgetting of not wearing your mask can have an impact on a very large population. So I just, this is amazing to be this far in. A person said to me today, said, I'll be honest, I thought we'd make it 1 week. And so I'm like, thank you for not sharing that 3 weeks ago. We appreciate that. But we can't let our guard down as this becomes the normal,
Yeah.
so. But again, thank you.
All right.